So I've been stressing a little bit lately. Okay, so I went to my orthopedic surgeon appointment, right? They told me that I can't have a full knee replacement thing because I'm too young for it and it just won't approve. I'd have to be like 50 before that would even be approved. However, due to the severity of my injury to my knee and lower, they want to do this like allograft thing, like get cadaver pieces, cadaver joints, bones, cut my fucking leg open and like shove that shit there. And it might take a couple times. So, but they need the state to approve it, so they need a second and a third opinion. And I'm just stressed the fuck out. like, like that's gonna be hours of surgery. But yeah, I just wanted to keep y'all up to date on what's been going on. But anyway, let's get rolling with this other episode of Mental Health Convos. Okay? We are going to talk about dissociative identity disorder. Now, this is characterized by several symptoms, which can vary wildly among individuals. Some of the common symptoms associated with DID is like the presence of two or more distinct personality states or an experience of possession, each with its own pattern of perceiving, relating to, and thinking about the environment and self. Amnesia. Gaps in memory regarding everyday events, personal information, and traumatic events. Depression. Persistent feelings of sadness or a flattened affect. Anxiety and panic attacks. Intense episodes of fear or discomfort. Mood swings. Rapid changes in mood that may not be related to external events. Hallucinations. Seeing or hearing things that are not present. Eating disorders. So problems with eating behaviors such as anorexia or bulimia, right? Sleep disorders, difficulties with sleeping such as insomnia or nightmares, suicidal tendencies or self-harm, thoughts of suicide or engaging in self-injurious behavior. Substance abuse, misuse of drugs or alcohol, difficulty coping with stress, challenges in maintaining and managing daily stressors, presence of phobia, irrational fears of specific objects or situations, debilitating headaches, frequent or severe headaches, okay? It's important to note that DID is a complex disorder that requires a professional diagnosis. Enough of these fucking TikTok, whatever, kids trying to say they have this shit, okay? The symptoms can also overlap with other mental health conditions, making it crucial for individuals experiencing these symptoms to seek evaluation from a mental health professional. Mental health professional. Treatment typically involves psychotherapy and sometimes medication may be used to manage specific symptoms like depression or anxiety. The causes of dissociative identity disorder are not fully understood, but it is generally believed to stem from a combination of factors, particularly severe and prolonged trauma during early childhood. Here are some potential causes and contributing factors. Severe trauma. So DID is strongly associated with experiences of extreme repetitive physical, emotional, or sexual abuse during childhood. The disorder often develops as a coping mechanism to distance oneself from the trauma. The inability to escape. The trauma often involves situations from which the child cannot escape, such as ongoing abuse within the family. Dissociation as a defense mechanism. During traumatic experiences, dissociation can serve as a defense mechanism, allowing the person to detach from reality as a form of psychological escape. Developmental age. The trauma typically occurs between the ages of 9, during critical periods of development when personality is still forming. Lack of support. A lack of safe and nurturing environment to help manage and respond to the trauma can contribute to the development of DID. It's important to note that while these factors are commonly associated with DID, not everyone who experiences such conditions will develop the disorder. Okay? DID is complex and multifaceted, and its development is unique to each individual. Mental health professionals consider a variety of factors when diagnosing and treating DID, and treatment usually involves long-term psychotherapy. The treatment options for dissociative identity disorder are primarily focused on psychotherapy, right? With the goal of integrating the multiple identities into a single, more cohesive identity. Here's like an overview of the treatment like modalities, right? Psychotherapy. I keep bringing it up. This is the primary treatment of DID and may include various forms such as cognitive behavior therapy, dialectical behavior therapy, and more. The therapy aims to help patients understand the nature of their disorder, like improve their relationships and integrate their identities. Hypnotherapy. Hear this, okay? A type of psychotherapy that induces a trance-like state to help explore thoughts, feelings, and memories that may be hidden from conscious awareness. Medication. Wow. Medication. There is no specific medication to treat DID, but medications may be prescribed to address symptoms such as the depression, anxiety, or psychosis. Common medications include antidepressants like fluoxetine, anti-anxiety drugs like clonazepam and lorazepam, tranquilizers like chlordiazepoxide, and mood stabilizers like lithium and valproic acid. Hospitalization. In some cases, hospital stays may be necessary, especially if there's a risk of harm to oneself or others, or if severe symptoms need to be stabilized. Self-care. Okay? Encouraging self-help and self-care strategies can be an important part of treatment. This includes establishing a routine, practicing stress management techniques, and engaging in activities that promote well-being. It's important for individuals with DID to work closely with a mental health professional to develop a personalized treatment plan that addresses their specific needs and symptoms. The treatment is often long term and involves a significant commitment to therapy and self care. Did you hear me? Okay. Supporting someone with dissociative identity disorder involves understanding, patience, and a willingness to learn from the condition. Here are some ways you can offer support. Okay? Educate yourself. Learn about DID to understand what your friend or loved one is experiencing. This knowledge can help you be more empathetic and supportive. Recognize their identity states. If possible, try to recognize and understand the different identity states. This can help in interacting with them more effectively. Provide like a safe environment. Offer a safe and non-judgmental space for them to express themselves in their experiences. Be patient. Be patient. Understand that healing from DID takes time and there may be setbacks along the way. Encourage professional help. Support them in seeking and continuing therapy, which is crucial for their recovery. Help with crisis management. By that, I mean, like, be prepared to help in case of a crisis and know what to do if they are at risk of harm. Maintain open communication. Keep the lines of communication open and let them know you're there for them without pressuring them to share more than they are comfortable with. Support their self-care. Encourage them to engage in self-care practices that promote their well-being. Avoid triggers. If you're aware of like specific triggers that might cause distress or like a switch in identity states, try to avoid them. Offer consistency. Try to be consistent in your behavior and responses to them, as this can provide a sense of stability. You feel me on that? Remember, each person with DID is unique, and what works for one individual may not work for another. It's important to communicate with the person you're supporting to understand their specific needs and preferences. Your support can make a significant difference in their journey towards integration and healing. Dissociative identity disorder is often misunderstood, leading to several misconceptions. Here are some common myths and the facts that dispel them. Ready for this? Myth. DID is not a real disorder. Fact. DID is a legitimate and recognized medical condition included in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Okay? It has been reported for hundreds of years and is supported by extensive research. That's number one. Myth number two. DID is extremely rare. Fact, DID is more common than many people think. It's not as rare as some outdated sources might suggest. Myth, DID is the same as schizophrenia. Fact, DID and schizophrenia are distinct conditions. DID involves multiple identity states, while schizophrenia is characterized by symptoms like hallucinations and delusions. Myth, people with DID are violent. Fact, individuals with DID are often more likely to harm themselves than others. This portrayal of people with DID as violent is a harmful stereotype. Okay. Myth. DID is just a severe form of borderline personality disorder. Fact. While DID can co-concur with borderline personality disorder, they are separate diagnoses with different treatment approaches. Okay? Myth. At least one alternate identity is violent. Fact. That is not necessarily true. Alters are diverse and can have a range of personalities, not all of which are violent. Myth. This condition can't be easily diagnosed or treated. Fact. With structured interviews and clinical practice, DID can be reliably diagnosed, and many individuals benefit from specialized psychotherapy that addresses trauma and dissociation. Understanding these facts can help reduce stigma around DID and promote a more accurate and empathetic view of those living with the disorder. There is no absolute cure for dissociative identity disorder, but there are effective treatments that can significantly improve the quality of life for those affected. Treatment typically involves, like I have said, a combination of psychotherapy, medications for concurring conditions, and sometimes hospitalizations for the more severe cases. The primary goal of treatment is to achieve integration of the identity states into a single, cohesive identity and to address the traumatic memories that often underlie the disorder. This process is usually long term and involves a significant commitment to therapy. I'm going to keep on repeating myself, okay? While DID symptoms may persist over a lifetime, many individuals can learn to manage their symptoms effectively and lead fulfilling lives with the right treatment and support. Okay? It's important for anyone struggling with DID to work closely with their mental health professionals to develop personalized treatment. Dissociative identity disorder is not considered hereditary in the traditional sense. Hear me out. Okay. While there may be a genetic predisposition that makes certain individuals more susceptible to developing DID, the disorder itself is more strongly associated with environmental factors, particularly like severe and chronic trauma during early childhood, like I said, like around 9 years old. Twin studies suggest there might be a heritable component to dissociative disorders, indicating a potential vulnerability, but this does not mean that the condition is directly passed down from parent to child. It's important to understand that DID is complex disorder with a multifaceted ethology, and more research is needed to fully understand all the contributing factors. Okay, with that said, I will end this video right here. I hope this gave you like a little bit more like a baseline to what DID is. Okay? Have a good day.